Thrilled to provide this training to you. So I'm Dr. Ashley Hagaman, and I'm a medical anthropologist and qualitative methodologist with the Center for Methods and Implementation and Prevention Science, with Donna and our group here at Yale. And Dr. Rhodes and I put together this presentation to share some of our own rapid methods implementation and the work that we've been doing. And I think just to introduce this a little bit is it's still a relatively new field, and there are many ways to go about it. So we're sharing the methods that have worked for us and have worked well with our teams. And as we go through the presentation, feel free to interrupt with any questions along the way. And we've also built in some time for questions at the end. So we're happy and eager to have your discussion. And we just want it to be very clear and helpful to you. So let's get started. So this training is intended to give you a solid understanding of rapid methodologies, arm you with the ability to determine when to employ this approach, give you the tools to integrate it within your own research programs. And we'll also touch on how to identify team characteristics and training needs in order to use rapid methods within your own research paradigms. And so we know that your work is rooted in HIV prevention. So we've tailored some of the examples and the resources so that they speak to your expertise specifically. But certainly we welcome any comments that you have about its relevancy and integration. And then I also wanted to note before we get started that we don't discuss sampling in great detail. In fact, that's a particular area that I have not seen much work on, and one that Dr. Rhodes and I are interested in providing specific insights into in the near future. So if you have questions related to sampling as it relates to this approach, we're delighted to talk about it with you on another call and help you through some different strategies. But I just wanted to flag that in the beginning.
Ashley, before you go on, do you and Elizabeth want people to write questions into the chat and then take them at the end, or would you like people to just jump in and ask questions as you go along?
Yeah, I think as we go along, I think would be good, just because I think it progresses. And then if we know that we'll answer it like a little bit later, we're happy just to mention that. But Elizabeth, do you mind like monitoring the chat? And then I'll do that like when you're talking. Yeah,
sure.
Thanks, Donna.
All right, good. Okay, so don't be shy, everybody. Just put your questions into the chat as we go along.
Yeah. Okay. So why do we need rapid approaches? So in the field of implementation science specifically, we're interested in expediting the time between research and evidence-based implementation. We work in fast-paced environments that are quickly deploying evidence-based interventions, and we need to be flexible to integrate the knowledge as we learn it. And of course, to save money and maximize the amount of data we get and maximize efficiency with some really careful attention to quality. And then certainly with implementation work, the goal is to provide feedback to implementing teams to support their ability to be nimble and optimize the care that they're providing. So I'm sure that everyone here is keenly aware that these priorities are a part of every research project. But for implementation science specifically, and work that's done, I will say, in complex emergency settings, it requires an additional speed and close attention to the environment. And I think that's why rapid methods or rapid approaches are rooted in an anthropological perspective and approach. And I'll touch on this a bit more in a minute, just when I talk about its history and its use. But a lot of the sort of design and deployment of these approaches have been led by anthropologists. So how long does rapid research take? There's a large range, and it really depends on the team. So I've seen anything, there's been a few different systematic reviews of collections of rapid approaches, and they have spanned from 3 weeks to 3 months. Sometimes it can really even be within a year, which is still a pretty quick timeline from research initiation to completion. I've also seen some within several days, but that's really more formative. But just to give you a sense, I think like the majority is between 3 weeks and 3 months. But at least the projects that we'll share, it's a little bit on the longer end. But the rapid part is like usually within that time frame. So there's a lot of terms out there for the general field of rapid approaches, and here are some of them. So I wanted to give you a sense for when you see these things, kind of what they might mean. Some are more formative and some are specifically evaluative, but they do have the same core strategies. So a lot of rapid work that I mentioned is rooted in ethnographic approaches, and this is because in order to get information in a timely way, with quality and with validity, integrating individuals with close sociocultural knowledge into the research process is really helpful. And so a lot of rapid work comes out of the VA with anthropologists leading those teams. And I put this like ethnographic quote, because I think particularly in rapid approaches, this like idea of rapid ethnography gets thrown around a lot. And sometimes folks might not really know what ethnography is. And I'm not training on ethnography, but I did want to give a sense for why this like anthropological perspective is like so important for this sort of work. And so I have this quote from Malinowski, who really says that anthropology is intended to understand what life holds for the population of inquiry. And in each culture, the values are slightly different and people aspire for different aims. But to study the institutions, customs, and codes, or their behavior and mentality without subjectively trying to understand and feel really what it is in the way that this population or the community that you're working with lives by, is to miss the greatest reward which we can hope to obtain from the study of man, study of humans. So this approach is really well suited for implementation where we seek to understand complex intervention climate for various health issues, and most importantly, where we seek to provide information that is close and intimate relevance for our populations in order to optimize success. So what do all rapid approaches have in common then? So first, the work occurs with multidisciplinary research teams, ideally with members with clinical or administrative expertise within like your study site. And that allows for efficiency in data collection and analysis. So part of the way that it can be rapid is by integrating experts and interlocutors that are intimately aware of the environment within which you are studying. And so the use of these ethnographic rapid methods can minimize the burden that's placed on a single participant and speed up data collection because there's already an intimate knowledge of the study setting and context. So there are several different data collection methods used to verify information, specifically through triangulation. And then of course, there's an iterative data collection and analysis that's done in real time to facilitate the continuous adjustment of your research question and give feedback to inform the implementation in real time. So these are sort of the core tenets that exist within all rapid approaches. And so if you go, if we wanted to go back to that slide, I would argue that there's a lot of terms that are used in this work, but all of those strategies are sort of using this general approach. And so I think the main take-home point from this training, I hope, is that rapid approaches are approaches, and it's a package of things that you can do. And so it's a methodology, not necessarily just a method. And so I've listened to a lot of conversations about doing rapid analysis, which is certainly one valid method and one part of the rapid approach, but that's not the entire approach. And so what makes this approach so powerful is that it's a triangulation of methods that's integrating information from various components. And it's a process with multiple investigators, often with intimate knowledge of the study location. And so Dr. Rhodes and I think about rapid methodologies as a collection of these package strategies to inform and frame our work, from the conception to implementation to analysis and dissemination. And it allows for high quality work throughout the entire process. So the package uses a triangulation approach, drawing from a suite of methods like the ones that you see here, like qualitative interviews and observations. And then the process is team-based and iterative. So these are, as you are conceptualizing your project and the methods that you'll use, these questions can help inform the design. And so most important is the first question that needs to be very clearly defined in order for rapid approaches to work well. So often rapid approaches work best when there's a deductive goal, meaning that you have a framework or a model that is already informing your inquiry. And so these are just some other things to consider, and we'll talk through these a little more as we go through the example. And so like I mentioned, rapid approaches work best when the research question is a deductive one, meaning that you know what you're looking for. So for example, what are the barriers and facilitators to primary care providers prescribing PrEP? And so it's important to consider the pros and cons of rapid approaches before choosing that you'll do it. There's overall less time in the field, less time with the data. So there will be some drawbacks. That's why we suggest using this approach when there's a real timely need for information, and that there's sort of a need to support iterative program improvements so that the project can like adapt and be implemented in a nimble way. And so then there also needs to be capacity to do the work in a compressed time frame. So there has to be a team that's set up in place that can do the work in a condensed amount of time, beyond only budgeting for data collection, for example. So then I just wanted to highlight when rapid approaches might not be as useful. So certainly when it's exploring a new topic, if it's developing or refining a theory, really to like dig into transcripts in like very comparative or grounded theoretical ways that just require a lot of time with like transcribed data or extensive field notes. And so the rapid approach is sort of quickly reducing data in a way that can help when you have a framework, but it's not quite so helpful when it's a much more exploratory question. So like a couple of examples, it's really well suited when we're trying to identify facilitators and barriers to implementation. But perhaps it's not as well suited when we're trying to understand the moral and normative expectations that are emerging in the HIV treatment revolution, right? So it's a much more like theoretical contribution. And so certainly within my projects and within Dr. Rhodes' projects, and I'm sure like some of your projects, you have very pragmatic sort of products that come out that are informing interventions. And then there are also contributions to like theory and the scholarly literature that are both important, but you would use a different approach and it would take a different amount of time. So now I'm going to go over the specific components that comprise rapid approaches. So this is a broad overview of how they might proceed as a project. So all of the methods that are indicated like that are indicated in the slide above, like the different formative and evaluative, like the RAPICE or the RAP approach, use these like this sort of strategy, but perhaps like with slightly different goals or research questions at different phases of a project. So it starts with team formation. and training, and the formative work to gather and establish the necessary information to finalize your study design, your sampling, your tools for data collection, and to really have your team up to speed on the environment within which you are studying. So this allows for mechanisms for community entry and document review that can help supplement that secondary data analysis that you'll be triangulating within your project. So the data collection and analysis phase, hold on, let me try and get something so you can see. Can you see my mouse? Can you? Okay, you can. All right. So that's like this formative phase. Then it moves into the data collection and analysis phase. And so these are like the hallmark approaches that are really completed together, right? So this sort of situation right here. And so here you'll have your primary data collection. So here I have like in-depth interviews and observations. As you're doing your primary data collection, every point of data collection has a RAP sheet. So this is a rapid assessment procedure summary sheet of that point of data collection. And we'll take you through an example and what they look like. And so this RAP sheet then, based on what you find in this particular interview or this particular observation, can inform like the iterative data collection. So maybe there are other questions that you need to add to your interview guide as you're learning new things. Maybe there are questions that you can delete because you've already met saturation. And so these are reviewed at regular team meetings. And so this sort of structure with the team meetings is built systematically into the rapid approach. And so the team reviews the RAP sheets and talk about like how to iterate this data collection process. From all of the RAP sheets, from each piece of your data, you can create a case matrix. So this is like the big summary of all the components within which you have collected data. So maybe this is 20 in-depth interviews that you collected alongside like paired observations. And so within this case matrix, then that's where the analysis happens. So this is like where this rapid analysis that I think probably a lot of us have heard about, that's where this is happening, is this arrow right here, to create like a summary sheet that summarizes everything that's been learning to date. And this is an iterative document that is living over time. And then and then this matrix analysis is done to produce a publication or whatever dissemination materials that you have. So this is like the broad structure for rapid methods, and we'll take you through step by step what this looks like. So I've mentioned data collection methods before. Here are like the main predominant methods that are used in rapid approaches. So interviews, right? Qualitative interviews, focus group discussions, observations. I wanted to highlight this cool method called periodic reflections that Erin Finley has written a really nice piece about. And so I'm happy to talk like in more detail about any of these things at another time. But her method is really cool because it's used instead of in-depth interviews to reduce the burden on participants and to consolidate inquiry. And so it's done with smaller groups with the implementation teams. And she does it multiple times over time. So instead of relying on like one in-depth interview or two in-depth interviews with one staff member, these sort of periodic reflections are a really cool way to keep getting little bits of information with smaller time with your participants. And then I also want to highlight the secondary data component and observations for triangulation. So the reason that rapid approaches can provide robust evidence is through this triangulation. So everything from emails to meeting minutes to program-based data are helpful in that triangulation process. So I wanted to quickly give you like a satellite view just to share like an overview of what rapid approach integration within a larger research program could look like. And so this is from some of my work in Ethiopia. And I just wanted to highlight that like this primary data collection that's happening right here is happening within 6 weeks. And we have like, this is that circle that you saw in the previous slide where we have these like in-depth interviews and team debriefs, and we're continually filling out field notes and a matrix. And we are not using transcripts to do this. It's just the audio and the field notes. And so I'll use field notes and rap sheets synonymously. They can be the same thing. And then, so from that, we did a rapid analysis and then fed that to the implementing team. So this is the larger team that's implementing the intervention at many, many, many different sites across the country. And so at this point, this draft report was fed to the team. They came back to us with lots of revisions. It was a lot of things that we hadn't thought about that maybe came up in our matrices, but we didn't sort of think of as like a really important conclusion. And so then we went back to the matrices and back to the field notes in order to then integrate that information. And then that report sort of allowed for the scaling phase to start. So it helped inform like how to implement the intervention moving forward in a scaled way. And then I wanted to highlight, like, this is like the classical, then like theoretical work that we're currently doing right now. And it's taking a lot more time. So this is like 18 months out from data collection. But this is really, we're making contributions. Ooh, sorry. Hold on. So with that sort of analysis, we're answering more complex questions related to cultural health capital and its relationship to healthcare satisfaction. But really the whole idea is that like this rapid analysis part took like 2 months plus this 6 weeks of data collection. So it took about 3 to 4 months. So this is an example of a rap sheet. And Dr. Rhodes is going to talk about it in a little more detail when she goes through the example. But I just wanted to start highlighting it here so you just have like a visual in your head of what I mean by a rap sheet. But it just has basic information at the top for who's preparing the summary and what the point of data is, if it's like an in-depth interview or an observation. And then it summarizes really important domains that you care about. And then rap sheets are not only for interviews, they can be created at each point of data collection and summarized at varying levels. So it's helpful. So you might have an interviewer that has their own master rap sheet for all of the interviews that they've done themselves and conducted. And so they have that living document with them as they go through the process. You might have a summary sheet for every site if you have multi-sited research, or every stage of data collection if you're doing it in the pre-implementation phase or in the sustainment phase. It really just depends on your project and what's helpful for you in order to sort of create the products that you're looking to create and answer your research questions. But the whole point is that these rap sheets are meant to facilitate data reduction quickly and like facilitate learning iteratively throughout data collection. So this is to highlight how data can be triangulated. And so I mentioned that the master summary that I mentioned with this master summary rap sheet. So team meetings are used to integrate all the things you are learning through your observations, your secondary data, and the interviews. And these all get aggregated into that summary sheet, and it's sort of added to and changed and iterated over time as you progress through data collection. So now we're going to start talking about what to do with the data. So in rapid approaches to do quick analysis, matrices are used to reduce data. So again, it doesn't require software and it doesn't necessarily require transcripts. Although of course, like if you can quickly get transcripts, which is, I mean, in my work, we have multiple languages that have to be translated and transcribed in like laborious ways, but there's also very quick ways of having transcripts. And so that's certainly like great if you can get it quickly and they're of high quality. And so matrix analysis is sort of like the umbrella analysis that is done with rapid approaches. Framework analysis is like a kind of matrix analysis that uses a pre-specified framework to define your themes. So like the CFIR would have like very specific thematic domains that you would be extracting from your data. Different implementation outcomes, right? And different implementation models. And so I also just wanted to highlight this cool method called mind mapping that I'm not going to train on because I've never actually used it, but I have some resources at the end of the slide because it's if there's very visually oriented folks they might find this method really helpful, especially when sort of talking through findings with stakeholders. So I just wanted to bring that to your attention because it's used actually more often in rapid approaches than I anticipated. So here's a basic matrix. So this is what your matrix can look like once you have a summary sheet. And it should be designed in a way that helps you answer your research questions. So here we have cases in rows. The raw data is segmented by main topics that you're pulling out from your rap sheet. And you can, easily transpose this if it's like easier for you. It's kind of all the same thing. But the broad approach to analysis is that you first familiarize yourself with this raw data, with everything that's going into the matrix. So you read and reread, and then writing topic summaries that Dr. Rhodes is going to talk about, iterate those summaries as a team, and then analyze and synthesize them into the summary documents and reports. And then I'm not going to talk a lot about interview guide design, but there should be consistent alignment across all of the project elements. So this means that the research objectives should clearly inform the interview questions and the summary template. So each one is sort of designed based on the other. And so this is why a deductive approach works best. So you already have a sense for what you want to learn, right? So you can already sort of have an idea of what the topics are in your matrix. And of course, a way that helps inform that deductive approach is by using your implementation theory model or framework. So now I'm going to hand it off to Dr. Rhodes, who's going to walk you through how this process can be applied.
Thank you, Ashley. We don't have any questions in the chat yet, but I encourage folks, if you have questions as I'm going through, either put them in this chat or shout them out. Okay, great. Thanks, Ashley. So today I want to walk through a case study that was adapted from one of my projects to illustrate how a rapid approach could be used in your HIV research. For this case, let's think about a peer counseling program with the aim of improving access to HIV care for low-income adults living with HIV in Massachusetts and Connecticut. The program typically provides services in clinics and people's homes through home visits, but because of COVID-19, the program had to shift rapidly from doing in-person services to using remote services and trying to communicate with clients via video calls, for example. And our partners were really interested in understanding what the effectiveness, acceptability, and feasibility of delivering the program remotely was, so that they could use that information to help scale the program in the future. So they were in the process of putting together their scale-up plan. And there had been some thinking about telehealth, but there wasn't a lot of information about what telehealth looked like. So this is sort of a natural experiment to learn from and to understand, do video calls work well in this population? Next slide. To prepare for this research, we assembled a team of 4 people. I was the lead researcher, and we had 2 research assistants who recently had graduated with their MPH degrees, and then 1 senior researcher who was very familiar with this particular program and the study context. As Ashley mentioned, it's useful to do a formative scoping phase. The way that we did that was we made sure that everyone on our team was very familiar with the program model and the setting and population. We reviewed program materials and protocols. We met several times with our partners who were implementing the program. And then we also started participating in some of the program meetings to just get a sense of what the services looked like. And we also worked closely with our program partners to understand what were their priority questions so that we could make sure we included those questions in our interview guide. Next slide. We used a convergent parallel design, which included quantitative work and qualitative work. For the quantitative piece, our goal was to understand the effectiveness of providing these remote services on a variety of different outcomes. And to do that, we used data that were routinely collected by our partners as part of their monitoring system. So that data collection didn't require a rapid approach, but what did require a rapid approach was the qualitative piece. This is where we wanted to understand the feasibility and acceptability of the remote services from the perspectives of a variety of stakeholders, including the program implementers, as well as the peer counselors and the program clients. And then at the end of this process, we triangulated the results. For the purpose of the presentation today, we're going to really focus on the rapid component here with the qualitative piece. This figure shows an overview of our rapid approach for the qualitative component. In the summer of last year, we conducted a total of 40 interviews, some of which were in English and some were in Spanish. And what you can see from this diagram is that as soon as the interviews began, we started holding weekly or even in some cases bi-weekly debriefing sessions. During these sessions, we discussed what we were learning from interviews, and that allowed us to refine our questions and our probes on our interview guide to be able to go deeper into each topic as we progress through data collection. So this is the iterative process of data collection that Ashley was describing earlier. We also established a process in which after each interview, the interviewer would send the audio file off to be transcribed and translated by a professional company. And this really helped us ensure that we could complete the transcription and translation process in a timely manner. This was important since, as Ashley was describing earlier, transcription and translation can be very time intensive and can be a bottleneck in some cases. We wanted to use our transcripts and we were able to work with a company that could turn those around in 2 to 3 days. So we felt comfortable that we would be able to get those transcripts fairly quickly. Then right away, we started producing our rap sheets for each interview. Then once we completed this whole process of interviews and our rap sheets, we moved all of the data into matrices. In parallel with this work, we were also trying to collect data from program meetings that were happening because implementers were talking about the challenges they were facing with remote services and coming up with different solutions and adaptations to how they were rolling out those remote services. And we definitely wanted to capture that as well. So we attended those meetings, and then after each meeting, we would put together a rap sheet and discuss those as a group to make sure we were capturing all of the key points. Then we used the information from the program meeting rap sheets and the matrices that we had developed based on the interviews to come up with different topic descriptions. So for example, we had a topic description specifically on what clients like or don't like about using video calls. Similar to what Ashley was describing, we shared our topic descriptions with our partners in order to get feedback. And then there was an iterative process of revising those descriptions, in some cases going back to the matrix to make sure that we were pulling out all of the relevant information and including it in those descriptions. Okay, next slide. So now I want to walk through the steps for creating the rap sheets, and then I'll show you how we actually moved from the rap sheets to the matrix. One note is you'll want to create a rap sheet template for each stakeholder type. So in our project, we created 3 different rap sheet templates, one for program implementers, one for peer counselors, and one for program clients. And the reason for doing this is that you want your rap sheet to correspond with the guide. And typically the interview guide, at least in our case, each interview guide was different for each stakeholder. So I think this will become clear as we walk through an example. This example is from the client interviews that we did. So the first step is you want to have all of your interview questions that you ask clients, and then you simply give a topic name to each question. So for example, our first question was, what are some of the reasons you joined the program? So our topic name was reasons joined the program. Our second question was around what do they like best about video calls? So then our topic name corresponded to that, like best about video calls. And then it's helpful to just include in parentheses, Q1, Q2, Q3, and so on. And you do that for each question that's on your interview guide.
Elizabeth?
Next. Yes?
I would just note that Ariana Means had asked, did you use summary rap sheets before the matrix construction?
Let me show you how we walked through it. And then if you still have that question, I'm happy to address it because I may be about to answer your question. Let's see. Okay, thanks, Debbie. Okay, so then you saw that we had these different topic labels for each question, and then you simply put that into your rap sheet. So it's very straightforward. What I do want to note here is you may find it helpful to come up with a label at the top. So for us, we had 2 different research assistants who were helping write these rap sheets. So I wanted to know who prepared each rap sheet. I also wanted to know the participant type. So here it would be client, for example, and that just helped us keep track of the different rap sheets with all of our different stakeholder types. And then the participant ID number will be important to include, so you know what rap sheet this rap sheet corresponds to a specific interview. Great, okay. So then what you do is once you have your rap sheet template, you want to test it out. And one way to do this is you can have the different summarizers that you have on the team use the template to summarize the same transcript. And then you can come together as a team and discuss how that went. A couple of questions that could help bring out some potential issues or see how well your rap sheet is working are things like, is the rap sheet capturing the information that you need? Are any topics missing? And is it easy to use? The way that you've created these different headings and sort of buckets of information, is that easy? Or are there any that you maybe want to combine? So for example, we found that in some cases, people were giving responses to question 3 and 4 in a way that was really intertwined and in the transcript. And so having those separate was actually more time consuming for the summarizer to try to pull apart that information. So we simply just collapsed those 2 questions under one heading. Is it well organized? So as the summarizer is going through the transcript, is it fairly easy to go through the rap sheet? And then how long is summarizing taking? Typically you want it to take about 45 minutes to an hour. But it could vary depending on the length of the interview and the richness of the interview. Next slide, thank you. Then once you have your sheet in good shape and you're ready to use it, you want to establish consistency across the team. You can have all of the summarizers use the template, again, to summarize the same transcript, and then meet to discuss similarities or differences in summarizing styles. Are some people providing a lot of detail while other people maybe aren't providing enough detail? You want to think about where you might include direct quotes, and just discuss across the team ways for you to improve consistency. And then you can repeat this process as many times as you need. We found that it took about 2 or 3 rounds of this before we felt like we reached good consistency. And then from there, you can divide up the transcripts across the team and just have people start summarizing it. I found that it was helpful as the team lead to conduct regular quality checks just to make sure that the summaries were looking good, and then also check in regularly with the team to see how long it's taking for them to complete those rap sheets. Next slide, please. Great. So what makes a good rap sheet? Ashley and I put our heads together to come up with some of the things that we think make up a good rap sheet. I mean, one is that it's brief. It is supposed to be a summary, so about 2 to 3 pages is typically about right. You want it to, of course, capture all of the major points. And you want it to be well written and understandable. So if I pick up a rap sheet and I haven't seen an interview, I should be able to understand what the key points were that came out of that particular interview. Also, it's nice to balance summary with specificity. And what I mean by this is sometimes we can summarize and you almost lose the meaning or the detail of what you're trying to summarize, and that's not always super helpful. So you need to think about what kind of level of detail do you need for your particular project, and then include the why. I'll show you an example of this in a minute, but we know that the value of qualitative research is to understand the why, and so you don't want to lose that when you're writing up your rap sheets. You can include illustrative quotes. You want your rap sheet to be useful. Some examples of things that we found to be useful is we would put page numbers for quotes, or if you're just listening to the audio, timestamps, so you know where quotes came from and you could go directly back to the transcripts if you need to maybe understand more of the context around a particular quote, or maybe you want to add more to that quote. You'll be able to easily do that. So it's almost like a pointer for you that will help direct you back to the transcript or the audio. Also including page numbers or timestamps for where to look for additional details or stories. So for example, if there's an interview where there was a particularly rich story that you might want to pull out to serve as a vignette or to include as part of a report, you'll know where to go to look for that information. And then I always encourage the research assistants I was working with to provide reasons for the absence of data. Why do they not have data for a particular topic? For example, was the question not asked, or did the person just not respond to that information, or that question rather? All right, next slide. Then, so this is your rap sheet. You simply are then summarizing here, as you can see, under every heading. So I just want to point out, so we have reasons join the program, liked best about video calls, liked least about video calls. Try to keep that in your mind because I'm going to show you how you move to the matrix. But before we do that, I just wanted to highlight one particular example of sort of the why here. If you look under question 2, the first bullet point, we have that the video calls were convenient. And then we included why they thought they were convenient. They liked not having to travel to the clinic, et cetera. That's what I mean in terms of not losing the why or sort of losing that level of detail I found helpful. Okay, next slide, thanks. So then what you do is you simply move this information into the matrix. So you see down the first column, you have your ID participant numbers. And then across the rows is where you include the information. So according to every topic. So here you can see for participant 1, we were just looking at that rap sheet. We have their information going across in that particular row. And then what you do in your data analysis is you go down each column to start developing a description about that particular topic. Next slide. Great. And I'll pass it over to Ashley.
And Ashley, I don't want to rush you, but just to let you know, I think we have 11 minutes left. Isn't that right, Debbie? Okay.
Yeah, so we'll be done in about 5 minutes. So with the matrix, like Dr. Rhodes mentioned, you'll develop topic descriptions. So that's writing kind of what's happening all down that particular topic column. And you can then summarize that by site or population, kind of whatever works best for the strata in which you're looking to do the analysis. And then those descriptions are used to then produce your final products, from the report to like summary of key findings, certainly like informing the main summary document and summary rap sheet, and then of course subsequent manuscripts. So things, we just wanted to walk briefly through considerations for how to build an efficient and productive team. So team members don't necessarily need qualitative research experience, but given the need for clear and succinct summary sheets, ensuring that your team members are good writers can save you a lot of time. So staff should have enough time to devote to the project, not only data collection, but all of the team meetings, and other sort of points of triangulation that are involved, and that you have a team lead. So Dr. Rhodes mentioned that she was the lead for this particular analysis, and she spent a lot of time reviewing all of these documents to ensure quality throughout the process. So if the team members are interviewing, it's also really important to take time to train them up, to be able to establish quick rapport with participants and effectively probe for examples and stories. So examples and stories are what are going to provide them richest detail and not just give general information. I like Zoom calls because it was convenient and leave it at that, right? Like there needs to be a probe as to why. And we've also like highlighted here some important topics to cover in the training. And certainly like making sure to create a work plan that allows for ongoing trainings, quality checks, and supervision of your team is going to help it be like very effective and help you gather rich information. And then another sort of quick note about rigor. So rigor is garnered through transparent methods and deep investment in the data itself. For rapid methods, team management is deeply important to ensure that when data is being collected and summarized, it's of high quality and answering the questions that you need answered. And that's why we really focus on those team meetings and discussions, and the team lead sort of being very deeply immersed in all of the data to help facilitate that. So you can establish consistency across summarizers first through the piloting that we mentioned, summarizing the same interview together, and then having ongoing quality checks that are sort of sprinkled throughout your data collection process. And then we think about validity checks with rapid methods by feeding information and lessons to the implementing team. And so that's why it's helpful to have that summary rap sheet, because that can be fed to the implementing team that then they can come back to you, or the informants themselves come back to you with reactions, questions, and feedback. And I would recommend doing that like at least twice throughout the process. And then, we often get questions about if I do a rapid approach, can it be published? And certainly, there's lots of examples of publications that use rapid approaches. The key, again, I think, is being very transparent in your methods, and providing insight into the entire data collection process and not just like the rapid analytic sort of matrix analysis that you're doing. So all of that deep work that you're doing with your team and like in the sites themselves will help provide some of the rigor that's needed for publication. So here are just some examples that we really like. And then we have lots of resources in case you're interested in that. And so with that, I'll end, and we'll have a PDF that's shared to everyone that attended this training, just so you guys have the slide deck as well. But with that, yeah, I'll open it up to questions.
So there's one question in the chat box from Ariana Rubin. Elizabeth, did you use summary rap sheets before the matrix construction here?
Yeah, so Ariana, do you want to share a little bit more about what you're interested in here?
Yeah, sure. So I noted in the Ethiopia example, there were summary rap sheets, and then the example you shared, there weren't. And I don't typically use a summary rap sheet before I go to like the matrix. And I was just kind of thinking about the pros and cons of that. And if you could, just kind of curious if you would use them or if you'd found them, like if you didn't use them, if you're finding that like a major challenge to some degree, but it doesn't sound like you have.
Yes, so we did not use those, but Ashley, given that you have used those in your work, maybe you could talk about the value of that piece.
So yeah, because the matrix isn't, we can't share the matrix with our implementing partners. That is just really challenging and they don't have time to go through it. So because we had this iterative summary of what we were finding, that's like how we did it. And I guess to be clear, it's like the matrix is being populated at the same time. So all those things are happening together. So maybe in that diagram, I should, yeah, like make it more clear that that's all kind of happening at the same time.
Okay, Ashley, there's another question in the chat box now. It's from Jacqueline Bannon, and she's asking, do you have any advice on how teams can be time efficient, team management software communications, given the potential barrier of team availability?
Yeah, I mean, I think, certainly I've had teams that meet daily for 15 minutes, and that like saves us time because we can just debrief at the end of the day around 5 o'clock and be done, with that. And then other teams where we like have weekly meetings, if you're including, yeah, I mean, I think it's all just about being flexible and figuring out a strategy that works, particularly if like implementers are a part of your data collection team. But I think being nimble and figuring out a schedule that works for everyone. But I do think some of the like more frequent but less time consuming meetings can also be super helpful. I don't know if you have other suggestions, Elizabeth.
One small suggestion that worked well for us was we had a process in which after a research assistant completed a rap sheet, they would upload it to our shared box and then just sent me a quick email saying it's up. And then that way, whenever I had time during the day, I would just do a quick review of it and then shoot back an email or schedule a phone call to address any issues. And that just helped us make sure that we were catching things that were problems right away, and that our team members didn't have to wait to get feedback from me in order to move on to continuing their other summary sheets. So we found that to help with our efficiency.
Yeah,
Okay,
and
so
I think that,
okay.
Oh, I was just gonna follow up and say it points to the importance, I think, of having like one point person that sort of has this like general like all encompassing knowledge of kind of what's happening and managing the data. So I see there's another question. I'm curious about what you think the pros and cons are of people who are not the interviewer writing the rap sheets. Yeah, that's a great question. So for pros, it's helping get other people on your team aware of what is happening in other interviews, seeing other techniques that are used, seeing what probes are being used. And so they're sort of expanding their awareness of the data set. And then also like providing sort of like inherent quality checks, and just opportunities for like improving the data collection efforts. From the cons, it would be very difficult to reconstruct what the interview was like and other things that the transcript or the audio cannot give you if you're not the interviewer that is writing the rap sheet. And so in that case, so certainly that's where like some of my favorite components are, to sort of like bring me to that setting, and like give me some sort of visual awareness of what it was like to be there. So you could supplement that with someone's field note that is also like attached to that interview. That's sort of creating that visual summary would be a way of getting around it.
So maybe Ashley and Elizabeth, I could ask one last question, then I think we should close. So I'm taking away from this that because of the interactive nature of the data collection and the data analysis, that when you use this type of approach, by the time you're done with your data collection, you've also completed your data analysis. Is that true, or is there more to do after this process as you described? That would be the final data analysis.
Yeah, so like Elizabeth mentioned, the descriptive summaries that are written from the matrix is like a part of that subsequent work. You can certainly start writing those descriptive summaries and add to them as you go along. But that would be sort of the remaining thing, that you don't want to leave out sort of those last interviews.
I
make
see.
sure that information is integrated. Yeah.
Okay, well, I'd like to thank our two speakers, Ashley Hagaman and Elizabeth Rhodes, for a fantastic presentation, as well as Debbie Humphreys for convening us and making this happen. So thank you all for joining us, and to be continued, I'm sure. Bye, everyone.
Bye.